Module number 1. This section will provide your 2022 COVID Management Employee Training Module. By now, we all know and have been observing many protocols to ensure that the coronavirus is well managed within our workplace. This section will provide a review of dental office requirements and clarification on proper use and current mandates for dental employee PPE, proper responses if employees or patients test positive for COVID, the containment of environmental aerosols, and expectations going forward. Keep in mind that while the ADA is a guiding force within the dental industry, they also do have disclaimers citing that they are not a governing authority. Always look to the most recent OSHA and CDC updates paired with state directives from your governor's office, state dental board, and state health departments to transition wisely into clinical practice. With this in mind, let's take a look at the present OSHA standards with regards to wearing, caring for, and disposing of personal protective equipment. You can visit OSHA's website for dental workplace directives. Here you will find specifics for what is expected to be implemented in the COVID comeback for the dental workplace. This table shows clearly that clinical gloves, full circumference eyewear, face shields, and lab coats or gowns are required as basic expectations. Important clinical treatment distinctions are made between non-aerosol and aerosol procedures and need to be understood by all clinical personnel. Only for well patients during non-aerosol procedures can a traditional Class 3 surgical mask be worn. For suspected or known COVID-positive patients, an NIOSH or equivalent approved mask must be worn. OSHA's COVID Dental Web link has great reminders about implementing current OSHA and infection control rules. Listed here are details of what is expected from all USA dental facilities. Provisions for making available proper-fitting personal protective equipment is critical. Reminders that providing a safe workplace free from hazards or serious harm is part of OSHA's General Duties Clause and the responsibility of every dental practice owner. OSHA and health department officials will be scrutinizing dental offices to ensure that you adhere strictly to current infection control practices, as listed in this document. The CDC Summary of Infection Prevention Practices for the Dental Setting. This is a 44-page document with 13 updated infection control requirements. This is a main focal point of all Dental Enhancements OSHA training sessions. Make sure that you have all 13 of these requirements implemented and running smoothly within your facility by now. You must also have documentation proving that all employees have been trained to this level. If you need help with these, please reach out to us. When implementing OSHA policies, remember to always adopt the strictest policy when comparing federal versus state OSHA laws. 28 states have stricter guidelines. On your OSHA facility report, we will provide you with access info to our OSHA State Laws portal to review and download your state laws easily. Finally, OSHA reminds employers to adhere strictly to the current GHS chemical safety standards to protect employees as they may be using even more chemical disinfectants than usual. Again, use of PPE when handling hazardous chemicals is critical. Module number 3. The section will provide your team's 2020 Federal OSHA Employee Training Requirements. Now we will review these required areas of federal OSHA compliance. Your Federal Hazard Communication chapter was just presented with your International Global Harmonization System certification. These two now become blended, as the U.S. has now joined the international standardized efforts for chemical safety. Next, your Exposure Control Plan training will cover your occupational hazards. Biomedical waste and bloodborne pathogens will be presented in tandem. And finally, your sterilization and disinfection requirements will lead directly into your certification for infection control for this year. Let's get started. OSHA stands for Occupational Safety and Health Administration. It focuses on employee safety within the workplace. OSHA was created in the late 80s for the industrial work sector as a means to decrease workmen's compensation claims in the United States. This was when the government made mandatory the use of personal protective equipment, such as steel-toed shoes, lifting belts, and hard hats to be used within the industrial workplace. Now we're going to talk about your occupational exposure within your workplace. Everyone has occupational exposures. All employees in the dental office have slightly different occupational exposures. For example, the hygienist has a different occupational exposure than the receptionist, dentist, or office manager. In the dental office, we have mechanical, chemical, infectious waste, radiation, respiratory dust, hearing loss, and dental laser exposures. And of course, most recently, COVID or bioaerosol viral exposures. You need to know your occupational exposures. They need to be categorized, rated, be in written form, and signed by each employee. This is a required OSHA document. OSHA inspectors will expect that you have these required employee forms ready for inspection within 5 minutes of them arriving at your office. So make sure you have all your employees know where this important paperwork is kept and are able to retrieve these quickly during an OSHA inspection. You will need to have these forms on file for 3 consecutive years for both your full and part-time employees. The first required form is your annual OSHA employee training form. Renewal clients will receive this in an email. New clients will find this in your white manila envelope within your package. Employees should sign this now or as soon as possible. COVID requires employees to wear respirators during aerosol procedures. And a respirator voluntary disclaimer form is included in our OSHA manual. Remember to locate this disclaimer, make copies, and have all clinicians sign it. We talked about your occupational exposures per job title. You will need this form on file for each employee specific to their job title. And each employee will need a hepatitis B vaccination record. Michigan requires the original records or a physician's note confirming you had or declined a Hep B series. And Ohio requires a doctor's note if you want to be exempt. Additional vaccination tracking is also now an OSHA obligation to keep on file. You'll need proof of training that all of your team has been trained and certified in the Global Harmonization System. Forms 1 through 6 can be kept all together within your OSHA manual. Our OSHA manual provides a 5-year organizer at the back for easy, logical locating and quick access. You will also want to scan and save these important documents. Keep them on a digital or cloud-hosted file with management access only for safekeeping. This section will provide your 2022 Federal HIPAA Employee Training Module. HIPAA laws protect the privacy of your patient's health-related information. It puts responsibility on the healthcare facility to protect and secure all identifiable patient health information. This is referred to as PHI, or Protected Health Information. It is important for all employees to understand what constitutes a HIPAA breach. All healthcare employees are responsible to know what a HIPAA breach is and understand the steps that need to be executed should a HIPAA breach occur at your office. A breach is an impermissible use or disclosure of patient PHI that compromises the security or privacy of that PHI. There are 2 kinds of HIPAA breaches. A minor HIPAA breach involves less than 500 patient files. Examples of minor HIPAA breaches would include sending or giving a patient the wrong invoice, emailing, texting, or faxing PHI to the wrong party, gossiping or employees sharing PHI inappropriately, disclosure of PHI to unapproved third parties, leaving office computer screens or documents unattended for other patients to view or obtain PHI. Examples of major HIPAA breaches involve more than 500 patient files being compromised. Examples would include hackers penetrating through office firewalls, opening email attachments with viruses that purge patient data, loss or theft of devices, sending and keeping unencrypted data, and the improper disposal of patient records. What is the best way to avoid having HIPAA breaches occur within your office with your patient PHI? Train all employees before they handle your patient PHI and then at least annually on your HIPAA protocols. Have routine meetings to review and update your HIPAA protocols. Discuss examples of possible breaches. Write new protocols for how to mitigate such occurrences. Use PHI minimally as necessary, then keep it stored securely and protected.